Runner's knee or patellofemoral pain syndrome is the most common cause of injury in runners. And in this video, I'm going to tell you exactly why it happens so that you have a greater understanding of how you can avoid it and how you can make sure this one injury does not affect your training season. If you're a runner that's tried to look up runner's knee, or maybe you've tried to search the more technical term, patellofemoral pain syndrome, and you get stuck trying to figure out, is it something to do with quadricep weakness? Do you have to tape your knee? If you're wondering, you have to stop running, and all of a sudden you have all this information, you're wondering what is actually accurate? What is the true cause of runner's knee? So you can get to the root cause in terms of your rehab and make sure that you're recovering faster. Let me break it down for you. So the technical term patellofemoral pain syndrome tells you exactly what's going wrong when you have runner's knee. The patella, which is your kneecap, the bone that sits on the top of your knee, and femoral, which is your thigh bone, your femur, there is a issue between how these two bones interact with one another as the knee bends and extends, and especially as you land with your running. So what is the root cause of runner's knee? Well, here's the issue. When you run and you land on your leg and your knee starts to bend as you absorb load, what happens is the alignment between your kneecap and the femur has to be aligned in the best possible way. If your thigh bone rotates inwards, which for many runners it does, what happens is, as the thigh bone rolls inwards, the kneecap rolls outwards. And when that happens, the alignment between those two structures becomes incongruent. It becomes so there's more force under a smaller area. And that's why you usually, with runner's knee, feel a sharp pain. So it's not because the kneecap is moving on the femur, on the thigh bone, it's the opposite direction. The thigh bone is moving underneath the kneecap. And that's a common misconception where runners get stuck. You may have spent a lot of time trying to tape your knee with cover roll or kinesio tape, trying to align the patella or align the kneecap. Well, plenty of research tells us that that might make you feel good for one run or two run, but it's not addressing the root cause of the problem. Because the thigh bone, because the femur is the thing that is rotating and causing the problem, that has to be addressed. But the question becomes, what actually controls your thigh bone? Is it the quadricep? Is it the muscle that sits in the front of your thigh? Is it your hamstring, the muscle that sits in the back of your thigh? No. Although those play a role, they're not the main player that controls your femur and what your thigh bone does. What controls that is your buttocks muscle, your gluteus muscle. So your glute muscle is perfectly designed to control your femur, to control your thigh bone. Your glute muscle, even though it sits in the hip, controls what happens at your knee. The way the muscle is aligned and the way the tendon is aligned allows you to make sure your knee doesn't roll inwards, make sure it doesn't collapse inwards. That is exactly what the glute is able to do. The question becomes, why don't runners know how to use their glute? If the answer to solving runner's knee is use the glute when you run, should be an easy answer, right? Well, there's an interesting problem that happens here. You see, in your brain, there's something called your motor cortex. And it's an area of the brain that the second you think about movement, the second you try to move, areas of your brain will light up to control specific muscles. Well, in your glute, it's a hard muscle to understand for most people. Because around that same area of your brain, you have your hamstring and your quad and your TFL and your hip flexor. All these muscles are in one area of the brain. It's very hard for you to isolate. This is where activation drills, such as clamshells and side-lying leg raises with a band and monster walks, and in the description below you will see videos of how to activate your glute. Check it out. I've created a specific video on getting your brain and butt to connect with one another to turn on that muscle. So check out the description. But that is a key part of rehab most runners miss. You see, they try to tape the knee or they take time off or rest thinking that it's just an inflammatory problem, when in reality, it's a motor control problem, meaning it's how you move that is the problem. So your brain has to be able to activate your glute, number one. Number two, you have to get your glute strong enough to handle the demands of running, meaning things like deadlifts and squats and Romanian deadlifts. You need a lot of strength to control a pretty high force activity. Every time you land when you run, it's 2 times your body weight. So you want to be able to make that muscle strong. And finally, you have to work on your alignment. You have to work on how your pelvis, hip, knee, and ankle all coordinate motion together to be able to reduce load on your kneecap. Again, that is the main cause of runner's knee pain, is that there's too much load under a kneecap and thigh bone that aren't aligned together. So is treating runner's knee just about getting your glute to turn on and getting it stronger and working on your alignment? That's probably like 80% of the issue. The other 20% is you have to get your quadricep stronger, the muscle that sits, the big old muscle that sits on the front of your thigh. Why? Because as you can see, the tendon, this piece here, the tendon of your quadricep attaches to your kneecap. And because the kneecap is where the problem is with runner's knee, this becomes an important muscle. Now, why is it so important? Well, when you turn on your quadricep, what happens is it will press the patella, press your kneecap into a groove. See this little groove here that sits in your femur? Well, the kneecap sits in that groove and it glides as you bend and extend your knee. Well, if your quad isn't strong enough, what then happens is the kneecap doesn't sit well enough in that groove, and that causes problems as well. That's probably why when you think of your runner's knee, you may have one day where it's on the inside of your knee, outside of your knee, it may be above your knee. It's going to move around because it depends where your kneecap is sitting. And that's part of the diagnosis. It can be very tricky because you're thinking, maybe I have multiple problems if this pain keeps moving around, when really it's just one problem. It's just runner's knee itself. So you got to get your glute on, you got to get it stronger, you got to get alignment. You also need strength of your quadricep, but in the right way. Meaning you have to do single leg drills. There's not a single point in time when you run when you're on 2 legs at one time. So you need to do single leg drills for your quadricep. What does that look like? That's single leg squats, that's step downs, that's single leg step ups. Drills that mimic running, that use the quad, and you can focus on alignment. Key piece of equipment here is a mirror. Have a mirror in front of you so you can see how your body is aligned. Once you are able to get that form down, you can then transition it back into running. One of the easiest ways to do that in research that we found to help runner's knee is literally to run with a mirror in front of the treadmill. And you can watch yourself when you run, and the key here is don't let your knees collapse together. And if you were to put lights extending out from your hips, don't let the lights drop one way or the other. Keep your pelvis perfectly level. If you can do those 2 things, you're going to be well on your way to solving your runner's knee pain. So, should you tape your knee? Yes, it can make temporary reliefs, but it's not a fix. Is rest the solution? Maybe for a day or 2 if you have inflammation or pain, but then after that, you need to strengthen and activate and align the tissues that make the biggest difference in your running form, your glute and your gluteus muscle and your quadricep. Is taking ibuprofen good? Yeah, you can take any pain relieving medications maybe for a day or 2 if it's really bad, but after that, don't you want a natural solution? And what better natural solution than to work the tissues that'll help your form anyway? So this is solvable. More than 90% of people that have runner's knee can solve it conservatively, can solve it within 4 to 6 weeks. And the exercises you choose and the way in which you do them should be done every other day. They should be done before you run to activate the right tissues. So when you go out and run, your brain is aware of those specific muscles that it needs to turn on to have the right form. And my soapbox is these are drills you should be doing anyway as a runner. Alignment is hard to control, and it is something you should focus on as a runner to improve your efficiency, to improve your running economy, to reduce your injury risk. So it's a win-win-win. All the side effects of doing the glute activation, the strength, and the alignment is that you become a better runner. What better excuse to do the drills than that? So that is the root cause of runner's knee, why you have it, the treatments that work, the treatments that don't work, and now because you know the root cause of the problem, you can get to the right solution. So be sure to check out my videos on turning on your glute, on running specific single leg strength drills. As you see here on the screen, they will help you in your journey to solving runner's knee pain. Hey guys, if this video was helpful, please like and subscribe. That would mean the world to me. Let other runners know about these videos so that we can help more runners around the world. Thank you so much. Until next time, guys, train smarter and perform better.